So let's talk a little bit about the treatment. What you're going to do is I'm going to utilize this coffee filter as if it was the skin or the dermis. And this circle here is the lesion. As you notice, the applicator is smaller than the area of the lesion, which means we're going to have multiple treatments to cover that area. So when you put the applicator through that area, you could have 1, 2, 3, 4 areas of treatment. One of the things I always recommend is that you take a marker, skin marker, and mark the area of the lesion on the tissue to help you. And I always think it's best to practice how you're going to treat before you treat, because you might find that there's a better pattern than what you had thought while you're during the treatment cycle. Because we only damage the unhealthy tissue, this is one type of treatment that you can get and kind of treat on aggressive nature. What do I mean by that? Here's the lesion. What we always recommend is take a little bit of an area outside of that region and treat that whole area. Because sometimes you might have stray cells that are outside of that lesion area. Because we don't hurt the viable tissue, you don't have to worry about being very conservative on the treatment. So you can go and treat on those outer areas as you're treating. So let's start with the treatment. I'm going to, just as we mimic the skin, one of the things that we utilize is saline solution. And it needs to be saline solution because that salt mimics a lot of your tissue. So you get your coffee filters and fold them over until you get a nice pad. Really make sure you get that area wet, nice and good, and then we're going to show how you treat that area. When you're using the saline and the coffee filter, I utilize like a plastic cutting board or a piece of plastic on top of the table. The reason for this is if you were to be treating on top of a metal top or some other top, that could impede the radio frequency in that area, would be the tissue, so you could have a problem. So I would use a piece of plastic to act as a barrier between the tissue and the tabletop.